from the
And so
16.
now you got, add 10 more to the side you just did.
Yeah.
Close the vertical down to that. Same
Lock
way.
it down.
Lock it down, open up the top, lay it in there and pull it down. Now you got 16 on this side.
Right. Got
Yeah.
it. So when the appliance comes in, I would have a step
Yeah.
like this or
Just-
right versus left.
Just like we had did on the
Right,
paper.
right. Only it's flip side.
That's to fool your brain until you get around to leveling
Got
and
it.
axling.
Yeah. How long do you think that would take to come down?
Everybody's different. How hard, how is everybody's cranial frozen? How bad? And how limber are they?
Okay.
And how big are they, and how small are they?
Okay.
But
But you can make that happen without, you can make that happen without unlocking the premaxilla with an alpha appliance?
Yeah, you go in after you do that, loosen up all your sutures.
Without, am I better off just getting an alpha appliance to just get the sutures to open up?
Well,
As
do you want vertical dimension? I mean, do you want
Lateral
do you want
expansion, you mean?
Do you want lateral?
No, I would do that only just to open up the sutures.
Why
I
not
don't
just
think
put
that's
the
ne-
appliance in and go in and just open up, just loosen up all the sutures?
Say that again?
Just go in and massage and loosen up all the sutures.
Just manually do the sutures
Do all the
instead.
sutures,
Okay,
and then put the appliance in, and let everything just go boom.
okay, all right,
Yeah.
okay, all right, thank you.
Runar, how come, why not a full arch lower appliance that gives, includes some cuspid disclusion, you know, like you have made at the lab, and then it gives you anterior guidance, you know, also. I mean, that would work too, right?
Anterior guidance,
Well, and cuspid disclusion,
you don't want cuspid, it's only in lateral excursion.
that's what I mean.
Yeah, that's okay.
I mean, it's just, it's a
That's
matter,
your
it's
goal.
a laboratory procedure, you know, you're taking, so it's
The laboratory to make what?
to make the appliance.
Oh, you're gonna have the lab make it?
Yeah.
Oh, well, I don't know anything about that. I make all my own appliances. The only appliance I don't make that I use is an L.
I'm sorry?
The only
Oh,
appliance
yeah,
that I
you
use
don't
that I
make,
don't
okay.
make is the L.
You know, because, I mean,
Anytime I've had a lab make a lower appliance, it takes me about an hour and a half to get it in the mouth. Because they don't know how to make it. They've never seen a mouth, they've never seen a case in the mouth. Now, and it takes me at least an hour and a half to get one to fit. Just the way it is.
You may fit the teeth and go
To
down.
go
with
down
the
and
teeth.
snap in so it's comfortable.
You know, the thing about the paper roll, I mean, if you close down the Aculiner, I mean, how do you know that you didn't over compress the layers?
Well, that's a judgment that you do when you close it.
Huh?
That's a
That's a judgment you do when you close it,
But
right?
when you put those layers in and you bite, you really squeeze that paper pretty good.
Okay, all right. So there is
You
a
don't
fine
have-
touch
you
here.
don't, you don't have a passive, when you're checking that thing, you don't have any passive pressure on that. You get pretty good pressure on there.
So instead of using the Bowley gauge to measure the narrowest part of the paper indentation, you just use that,
Yeah.
use the paper
I
layers
use the
directly.
paper. If
You
you
use
want,
the
if you
paper.
wanna measure with a Bowley gauge and set the Aculiner to that level, that's fine. And then
Okay.
measure for the other side and set the Aculiner and do that side, fine.
Okay, okay,
Yeah. I just think it's a lot easier, just put the paper in there, it's real quick.
okay, okay, got it.
But
Thank
you
you.
can do it either way.
Okay, because, you know, it's easy in Joseph's case, it's, you know, 4 millimeters on each side, it's
Yeah.
very different with 6 and
Yeah.
16.
But when you put the paper in and close your teeth on it, that paper bends a little bit in there. When you put the Aculiner, it's flat, it's not giving you the same height really.
Right,
Because your teeth are allowing, your teeth have indentations, your custard,
right,
you know, so
right.
you're not getting the same
But
close.
you're close enough.
Yeah, you're close
Yeah,
enough.
yeah,
So I
okay.
just like doing it with the paper, it gets me closer from the start, I think.
So you basically peel off
I'm not
6.
saying I think straight, I'm just saying I do it that way.
Right.
You
So-
might think better than me, you might have a whole different better.
No,
way
no,
of
no,
doing
I
it.
mean, I need a starting point, so
Yeah.
what you do is you take 6 off the 16 layer
Yeah,
side,
yeah, yeah.
right?
Right.
And
Close it back down.
you put that on the side that's already filled
Yeah,
out,
right,
okay?
right.
And then you set the vertical post to
to
that
that.
thing, lock it down,
Yeah.
and then open up the member, reline it,
Yeah.
and then close it
Yeah,
down.
right.
Thank you.
And that's a real easy way to do it, especially when you're gonna go to, from super T to composite. Cause then you can go in there and just real quick, grind off your super T as much as you want, put some composite on there, close the thing down, you put a little extra bonding agent on the top of the teeth, tap them in a little bit, and then close it and set it while it's closed.
You do composite when you want to make it long term.
Long term, yeah.
Yeah.
When you get to the point where you know they're not gonna change a whole lot, then I go to the composite.
So there
Because
may be,
in the initial thing, if you have to change it, well, it's harder than heck to keep grinding that composite.
so they may be in the composite part for a year.
Yeah.
So like the hard splint with the super T is about 6 months,
Yeah,
roughly.
roughly, yeah.
roughly, until they don't change much
Yeah,
now.
until I know they're not changing. I just had a gal, this was a gal who was in a car wreck, and she fractured her left condyle and laid it sideways. They took her to the hospital. The oral surgeon didn't want to go in and treat her condyle. So he just wired her jaw shut and let it heal that way. Kept her jaw
Wow.
shut
Wow.
for 6 weeks.
Okay.
So she was a gal that does ballet, you know, on her toes and all that. She got till she couldn't hardly walk, let alone do ballet. And they went to 6 TMJ guys in Seattle, and they looked at this record and said, we wouldn't even know what to do for you. We can't treat you.
Okay.
So finally, her chiropractor in Puyallup said, the only one who can treat you is Dr. Johnson. He's the only one you got a chance with. And so she came up and I did the thing, and I checked her, and I checked her vertical, and I said, well, it'll move a little bit. And I said, you still got a tendon in there, I'm sure. It's all laid over, but if we can get that open enough, and get you moving a little bit, you'll form a pseudo disc in there eventually, and you'll be able to do okay.
Okay.
She says, okay. So I arm reflex tested her, took all the measurements, made her an appliance, put it in, had her back the next week. She was translating, and I'd say 80% of her pain was gone. She was absolutely floored. Within a month, I had her back up on her toes doing ballet.
Oh, nice.
How about, thank you. And that reminded me of a new patient I had this week, Monday. She had came in with an anterior open back. She had a right condyle is that much longer than the left condyle. What do you do for that case? And they've screwed her up orthodontically.
Yeah, well,
Yeah.
the treatment's the same.
Same protocol.
Level the maxilla, treat the mandible till the condyles are in the right place. It might look really funny. Might be 8 millimeters open here and 2 over here.
Would the two halves of the condyle eventually even out? I mean, are we stuck with this discrepancy?
Well, if the
in the
ramus
two
is
halves?
actually that much longer on that side, then they screwed her up. Now you gotta do it with the teeth. Unless she wants to go back in and have a mandibular resection. And when they do a mandibular resection, if anything comes out right, it's an accident.
Right.
Yeah.
But how do you gonna close down her anterior open bite though? I mean,
Build up.
I don't wanna start without knowing how that part's gonna get done.
Build up.
Huh?
Everything you do is build it. You gotta get her comfortable first with an appliance and then build it all up there. If you get her comfortable that way, then you build it up there. It might look funny, but it's, it's what you can do for her.
Okay, just follow the protocol, in other
Yeah.
words.
Protocol doesn't change. Patient may not like it.
Okay.
I'm gonna lay in the chair and you guys are gonna arm reflex test me.
Can you look at my teeth?
Yeah, sure.
Because, I think Bill's been adjusting his one.
Okay. Yeah, have a seat.
Okay. And then we're gonna test you, that'll be fun.
You want me to just, to look and see what I think of what's going on orthodontically in there?
Just kinda tell me where you think things are. I know I've got these little buildups to press my teeth, but I had to open myself up some.
Yeah, the second molars always get depressed when you do that. If you-
All
if you-
these are on the bicuspid.
If you, on the bicuspid, so you're pulling up the molars?
So,
You got them on the bicuspid to pull up the molars, is that what you're doing?
uh-huh,
Okay.
yeah,
Yeah,
they're,
that works on people. Yeah, open? Oh, you don't have a second molar, that's why. You better do it that way. Right. You got wearing up and down elastics on there?
do you think I should now?
Well, you have
Am
to.
I, well, I mean, am I in a good spot to do that?
Well, the faster you're up those teeth, better off you are.
Okay.
So what you do, you see, you gotta,
So could you test me and see if I test her right in this position, and then I could start wearing
well,
the
you
rubber
gotta, you
bands?
gotta get your, have you put yourself on the incline?
It's on that side, right?
Not lately,
Oh, but you did originally?
a long time ago,
Okay,
yeah.
You gotta just draw a picture and show what you gotta do on there. Okay, I look in here,
Mhm.
okay, so you're functioning off of these two, right down. You're pretty good right here.
Mhm.
Okay, so
Yeah.
what you've gotta do is, okay, you've got to pull these 2 teeth up to this level and this tooth up to this level. So what I do with these is I take this wire, 016 wire, into the molar, and I put a great big up bend in it. I go from the bi to the molar with a just a big up bend, Z up bend in there. And then I have her wear an elastic, triangle elastic, hooked onto this one and 2 up here. Triangle
The
elastic.
up end will be this way.
Up end's up where you want that tooth.
So
to
you
go.
have to put that in, you basically compresses this thing, so you'll get the,
You use a
okay.
spring wire.
So you bend it up in the direction that you want the tooth
Yeah,
to go.
yeah.
Okay.
And a nice springy wire, that'll
Okay.
bend.
016.
016, maybe
Stainless
usually
steel?
an 016, maybe an 014, you know, 016 at least. And you put this up bend in there, and then you wear a triangular elastic from the molar up.
Does it need to be a square wire or can it be a round wire?
Round wire,
Round wire?
round wire.
Like a stainless steel one?
Yeah, because it's hooked to these, it's hooked to these buys, and so you're not gonna lay the molar over. 'Cause the wire's
Right,
there.
right,
You're not
right.
gonna lay that molar over, so
Right,
you're gonna
right.
pull that molar straight up. And you just you do that, and you keep wearing the elastic, and you keep increasing that up bend until that molar touches up here.
Okay.
And you do the same thing on this side at the same time,
Okay.
until you get the teeth touching. Then you leave the teeth touching in an adult for about 3 months.
Mhm.
And then after those are touching for 3 months, then you can start, you cut off the tops of these,
Mhm.
and then you put an up bend on a wire to those, and you wear the elastics on those, and you pull those up to that level.
Now, where does the up bend go, cause I can't
Right.
see where you're
Your
pointing?
the up bend goes right distal to your second buy.
Okay.
Up bend, and
Okay.
then you bend it up high enough so you can still get it into the molar,
Mhm.
okay? So you do it in increments until the tooth is erupted.
Okay.
Then you keep those up for 3 months, then you start doing the buys.
Okay.
When the buys are up there, then you just level your anteriors to wherever your bite's supposed to be at there, and that's it.
Now, can you test me and see if this is all
Yeah,
right?
yeah, give me a minute. And open your mouth a little bit, and just relax, nice and relaxed. Nice and relaxed, real floppy, there you go. There you go. Okay, bite your teeth together, and relax a little bit. Yeah, that's really suitable for right now.
Okay. I have some neck problems.
Yeah, well, you got all those brackets and you're just biting on 4 teeth, yeah, you're bound to have some neck problems, let's check you.
Okay.
A little scar?
This is position.
Position.
I'm gonna have to catch it clean.
Oh, okay.
And
I'm gonna
those
call you
sheds
up.
just
Just
right
right.
there.
Yeah, I gotta call you up to get Merle's number, so.
Yeah, I got
can-
that stuff, I'll get it over to you.
So, I'll put the pressure on it.
Okay.
He's saying the manual's shifted to her left just a little bit. It should be over to her right more.
Well, it's on the, it should be shifted this way a little bit. Yeah, that will put the midline off farther than it is right now. If the midline's off about 1/4 millimeter, that'll put her off maybe 1/2 or 3/4 of a millimeter. But if,
Irregardless, the jaw's still,
if, you see,
maybe shifted to the left.
if these things weren't indented and they were flat, so they can slide, then her jaw will go where it wants to go.
Yeah, let's go.
And when she gets all the teeth erupted, then she's gonna make a diagnostic appliance, flat on top, put it in there and see where the jaw goes. Right now, she's, her system's rebelling right now, but it's gotta be done.
Cause she's locked. Why don't we just flatten this?
Well, she
Flatten
could,
these composites.
she made these things here all indented, but it should have been just flat, I think. Make wide and flat, so they can just slide.
But that means that she won't be able to floss in between those two premolars, right?
Well,
If you make it wide and flat.
Yeah,
She had the
yeah,
super
but-
floss underneath.
a little super floss and floss in
Yeah.
there. Like that. In your hands. And just relax like that. Yeah, see, she's at the bottom of her freeway space, but she's actually even a little better up there. Can you feel that?
Yeah.
You can feel that, yeah.
Mhm.
You're even a little better up there. So
Mhm.
for right now, you, this anterior stuff, you'd be open just a little more.
Mhm.
Open. You know, I'd say maybe 4 paper thicknesses, and then you make them kind of wide and flat, so you can slide around on them while you're
Okay.
pulling those teeth up. They're harder to chew on,
So she's slightly overclosed even now.
just a little.
Mhm.
But-
Can I have that paper?
Yeah,
Thank you.
yeah, that's what, that's what,
That's good.
Okay.
yeah. And then I don't know where your maxilla is, but let's just tilt your head back a little.
Okay.
Well, put yourself on the Aculiner. And I think you're torqued up on the left side.
Narrow.
Oh, the arches.
Arch is narrow. Yeah, a little narrow. Yeah, what you feel a mid-maxillary suture, and she's got a bulge in there.
And,
Feel that?
and,
Yeah.
teeth is
Yeah.
inward.
You know what?
Inward, yeah.
If you look at her nostril, she's narrow on the left nostril, so you're internally rotated on this side.
A tongue problem.
Yeah,
And that's why
That's
they
narrow.
form those
Tongue
tori.
problem, tongue
yeah, yeah,
address,
yeah.
you know, left side or right side, tongue premature contact, inward surface. Yes, problem.
Yeah.
You can take a
What's the problem?
camera picture of your nostrils, and you can
I
see
can-
that.
And you
I
can do
see it
that,
already,
you can
yeah,
do
I
that, and you
fixed
can
it.
look, you can look at her cheek.
Yeah.
This one's like this, and this one's more low.
Yeah, right.
She's just pushed in right there.
Yeah,
I
yeah. So
can
you
see
want,
it on my lip.
you
Yeah.
wanna use asymmetrical expansion with the LF to get that freed up, right?
Yeah.
Cause there's no other way to do this that I know of, do you?
Well, the old plastic ones we used to try to do, you know, the old plastic appliances with a single
The
screw.
Schwartz, yeah,
Yeah,
the-
Schwartz with a single.
it just
screw.
expands out the externally rotated side more.
Yeah,
And
yeah,
so-
yeah, right.
Because this, if you look, isn't this side out pretty far? I expanded with a nail before. When you look at my, do I have room for expansion?
Well, you
You're
gotta,
still internally rotated on your
this
left,
side.
yeah. Your left cuspids is still,
So I could use a nail there?
yeah,
yeah,
using an upward approach. and then-
asymmetrical expansion. You
And
wanna
then, be
Which-
sure,
which
get,
out? The-
be sure. get-
standard L.
The standard out,
Yeah, you see, she's an extension right
Yeah.
there. Big ridge right there. So you gotta really go in and loosen up the sutures when you do that, so you're not locked. See how big this is right here? Just a
Mhm.
big bulge, that squamous suture is all jammed there. And this is jammed here. Run your
Some
hand-
other
You
stuff.
can feel the suture is heavy there?
Yeah, run your hand across the top and feel how high this is right here. She's locked in flexion.
Wow, this is one right here, huh?
And you feel,
Yeah,
see how heavy that is?
yeah, yeah, yeah,
So all her cranial has to be loosened up.
yeah.
Right here.
Mhm. And the best way to do that is with an L.
Yeah.
Yeah.
I don't understand what, owl?
ALF, advanced light wire function.
I
And you
would.
expand, and you expand just on the left side.
Okay. I'll get it right.
But you have to put a through by elastic on this side.
A what?
So through by elastic, you hook from the buckle of this upper to the lingual, the lower on this side. So that that would hold this side, so that you can anchor the expansion on this side.
You see, if you're trying to put pressure out here, there's equal and lateral pressure going this way, so you gotta counteract it. If you put elastics on the inside there,
Yeah,
okay, then they put enough pull on there that this real light wire will expand that side out.
right,
Mm,
yeah,
okay.
yeah.
And then, of course, when you do that, you're gonna have to expand the lower too.
Right.
So
So
you
you
gotta
need
do
upper and lower in the
So you
same.
need to get that done, and you need to do a lower elbow.
Yeah. Yeah.
Do the upper first.
You do both at the same
You
time.
can
you
do-
can.
Yeah.
Okay.
The only trouble with doing them both at the same time is that when you put the elastics in here and you got this expanding, the elastics are gonna pull this expansion farther, faster. So I would do the upper, keep it with a wire, good wire in here to keep this lock, get the upper out where it belongs.
Wait, say that again?
Well, you got equal and opposite forces, so
Mhm.
now what you've gotta do, you got elastics
You
going
got
from
through
the buckle
elastics
here,
here.
through elastics to the
Yeah.
lingual.
Yeah,
Okay, and you do a lower L, now you got expansion here, you got, with the elastics here, you got more expansion on this side than this side. You got more pressure on the right than the left hand. So the alpha is gonna expand her more on the right than the left,
on the mandibular side.
on the mandible. But if you keep her in a good wire here and put it to the inside and get this out where it belongs, then you can do equal expansion on the lower.
Oh, in her
You're
case.
you're
in her
equalizing
case.
the pressure.
But in patients, before you strap them up, do you have to suffer that consequence? Of
If you're gonna pivot the top off the lower to stabilize it, then you gotta do the top first, I believe, and then do the lower, once you get the top where it belongs.
Right, right.
And then put a wire in there and keep it out there,
Interesting.
and then do the lower. Depends on how far you want it, where you want to expand the lower to meet the upper.
But how do you do it?
You're gonna need more expansion on the left than the right, probably on the lower, to keep up with the upper.
Right, that's
But
correct.
if you got more force on the right than the left, you're
Yeah.
gonna expand the right more than the
Right,
left.
right. So, but you have to have the through elastic in order to release the internal
Yeah.
rotation here,
Yeah.
so how are you gonna stop this from expanding out on the lower right side?
You don't use your elf down there until you get through with the upper.
So what do you do with the through elastic? You use a band or bracket or something?
Yeah, you mean, you're talking about elastic from the buckle here?
The through elastic,
Down
yeah.
to the lingual here with a
You,
button in
you
here.
use a lingual button, just
Yeah,
a
yeah,
lingual,
just a lingual.
use a lingual button,
Button on the band,
okay.
yeah, or on the or.
Or you can use a lingual bracket like
Yeah.
kind of button, you just snap it on there, right?
Yeah.
Does that bother the tongue?
No, they get used to it real fast.
Really?
Yes, they get used to it.
And
Yes, it bothers
she
them.
doesn't have any bands on there, so you just take a button and.
Yeah.
And bond it on there.
Yeah, yeah,
And
yeah,
then you run your elastic from
Yeah.
out here, from the hooks out here,
Yeah.
under that button.
okay.
But
So
I'm
you're
saying-
saying that if you do that, then you won't overexpand,
Yeah.
you won't pull this,
Yeah,
side
if she
out?
keeps her cranial sutures going, you won't pull that side out so much, and you'll allow this side to go out. Once this side gets out, put a wire to hold that out, now you can expand the lower equally.
I
Because
see,
it's
I
all,
see.
it's all in where
It
the.
takes longer.
It's all
but-
in where the pressure goes,
Yeah,
you know, how
okay,
you want to
good
expand
point,
it.
good point, good point.
You gotta know
Good
there's equal and
point.
opposite pressure going somewhere.
Right, right, okay.
And I'm assuming, from looking at her bite, right now, even now, needs more expansion on the left
Right.
than the right.
Yeah, she does.
So now if you run those elastics and put the alpha on the lower, the same as the upper, then she's gonna be really more expanded on the right than the left.
Right. That's a very good point,
Yeah.
thank you, thank you. Okay.
Thank you.
So where's she gonna get all this treatment? You're seeing an orthodontist or no, you have a?
You're gonna see Bill. You're gonna force him up the learning curve.
Yeah. Raise the learning curve.
Yeah.
Can you check me?
I have a second, I'm missing a second molar here.
Yeah.
And this second molar is built up a lot. And I wonder if this, just check me to see if this molar, second molar needs to be cut down some, or is the lateral interference is driving my eye crazy. I know you checked the upper left side. I feel that my number 31
Is
is
this your glass?
a major,
Get some water.
I need some
I'll get you some
more.
more.
I like one of them already, but I need more.
my number 31 is a major problem
You're pointing to,
in my vision, huh?
you're pointing to 31.
Yeah, this one. Should have brought my model.
We should have had a bring model, too. When Jim came up, I had him bring a bunch of models with him.
Yeah.
I didn't have to do it in the
You
office.
duplicate everything, huh?
Yeah.
Right here, you want some paper or
Here,
you?
would be the best, just so I could see better. Well, why is that built up so much?
It was a comedy of errors upon errors, so. The idea is that I need a fair amount of buildup, 6 and 16, right?
Yeah.
So on this side, I need to build up 6, so why cut that down in the first place? But right now, it's driving me crazy, actually.
Do you recall which side is which, right and
No, it doesn't matter, they're equal.
You're,
left? Oh, they're
you're
equal,
on both
okay,
sides.
all right.
Right now, slide forward. Right now. Right now, slide forward.
Electricity interference.
Oh, you have a
Gun
mirror.
piece? Yeah, I have this.
You have a mirror
Uh-huh.
right now?
You want a carbine?
You know, it might be driving, I'm just gonna look in there. Can I use that mirror?
Sure.
Right now? Right now? Right now, stay close. Well, you're not gonna get any real bite interferences out of that too.
What's he doing?
You've got those built up already.
What's
Still
helping?
haven't got this thing
I'm blocking.
now,
Here.
right?
What's going on with the second molar?
Well, it's got a big buildup on it. And I'm wondering that should be cut off right now. You got a big buildup on this one, way in the back there. And, slide to the left. Okay, right now, slide to the left. Now, you got a interference right here when you slide to the left, you got an interference right there when you slide to the left.
I'm gonna label maybe one of the.
Yeah, he's got one right back here. He's got one right there. See if that's across too.
Anyway, that was your money. Let's wait. We got even a new paper from you. Storage.
Recycle.
Yeah.
I feel there's a balancing side interference there too.
first molar.
With that second down there? Yeah.
You might remember he's got these buildup.
There's some green paper
Where-
in the burn.
Would you mind taking it down for me? Please?
What kind of burn? Is that for the acrylic or?
Is that a real fine cutter?
No, not the fine cut down here.
Real fine cone.
For-
I want the green paper.
That'd be
Good.
good.
My vision has been going
It's a
nuts.
polishing, carbide,
Vision?
Yeah.
real fine, even by your standards.
Mhm.
And I
Getting
get you some
blurry or
green
something.
paper.
Up close.
And I don't
Kind
want
of
my,
look-
yeah, I don't wanna fix my, glasses until this is done.
Mhm.
Yeah. My,
My vision's gotten better, by the way, since I was just checked.
All right.
I says, does that happen, that happens to quite a few people? No.
yeah,
Well, she says, well, some. I said, how about you? She says, no.
yeah, I didn't wanna fix my glasses until then.
Two by six.
My eyes are getting better.
Your eyes are getting better?
Yeah, may have something to do with the clients.
Oh, that'd be great.
Better how? Visual clarity?
Well, I mean, I can, my right eye especially, I can see, I could drive around, no problem. My left eye's a little blurry, yeah.
That's really great.
Yeah. Yeah, let's just check last month.
But you know, we can just scoot this over so it's left-handed,
That's okay. Maybe
now that we're at the end of the second day.
let me just tap it down here. Tap it down.
Your hand.
Like that. Slide to the left. So you're sliding to the left, and you're walking up these inclines in here, real heavy. These inclines right here,
Mhm.
and now we're gonna do the other side. Here the red marks are, right in the middle there, and right in the middle there, and right in the middle there. So,
Mhm.
They done, huh?
Oh,
and
okay.
right down, slide this way. Well, that's pretty clear that way, right now. Slide this the other way.
Is he gonna have a group function then, I guess?
He's got group function, he's got group function here. Group function here, where he's just heavier here than he is up across here and here. So I would just touch those two little spots. Just touch this little spot a little bit. Touch that little spot a little bit.
First one isn't too heavy?
This first motor,
Mhm.
and this spot right here,
Mhm.
that's an Kuzo spot.
I heard that.
Yeah. And really dangerous to adjust these.
You already know that he has to be, what, more open with his foot?
Yeah.
Well, yeah, it's
and
16
he hasn't been
six.
wearing a diagnostic, so I had a Kuzo thing there, I don't know,
You don't wanna touch it.
it makes me nervous.
Okay.
So we're gonna get this group thing just a little better here. Now we're getting better cuspid conclusions.
Cuspid, yeah.
See the cuspid's coming in
Mhm.
more here, and these are getting darker. And this one just doesn't like that group function, especially.
Doesn't like it?
Doesn't have this, he's just on a roller there, he didn't like that. Now we got that a lot better. You got most of this group function off of here. See how this is hitting now? Wasn't hardly hitting before. Now he's got his cuspid
At least they're
reception.
involved.
Yeah, he's got that one involved there. Now he's getting heavy. You see, not only is he just heavy here, You had it here, here, and here. Went down the line there. But don't bite, let me tap it for you. We'll
So that's
see.
the lingual cusp of the Evers going across those lower lobes.
Now, you got,
There's the two,
you got three nice contacts right
Mhm.
there in center. Okay. But, and we wanna make sure when he slides, he's not riding up these inclines in here. Slide down, slide it up, and the other way. Okay, so you don't want these things, you don't want those things riding up these inclines very much, not MDR. You see it, you're riding up that incline, that. Those are three balancing interferences all in a row.
There's some green.
I feel that.
Yeah, so now we're gonna.
You want that in
There's
dentures,
some
right?
green pepper.
You want that in dentures, you don't want it in natural.
I like dentures the same way as natural. The only thing that's different in dentures is you can't put as much force in the anteriors with the denture. The conclusion's the same.
It's the same.
I make them the same.
Yeah, but don't you have to keep them from rocking down? Don't you have to keep a balancing contact? Do you have a working contact on the other side?
I don't.
You know?
If
You
they
cover
work-
chew on both sides at the same time.
Well, if they work good and they're balanced, they don't have that problem.
Well-
Only if they're not balanced, they have that problem.
Well, yeah, you might be hitting too.
If you got balancing interference, balancing the denture, if you're sliding out to the left and you got balancing interferences on the right, you got the same muscle patterns if you got teeth in your own
Oh,
teeth in
you
there
get the
giving you
muscles
balancing
going.
interference.
I'm just
The
thinking about
same thing.
stability of the denture, and you're thinking about the muscle.
If you really got the thing balanced, it doesn't make any difference. Denture's gonna be good.
Muscles are balancing the thing.
Yeah. So
Well,
we're
I'm
gonna-
asking because I got a patient that says she can't chew, and it goes back to what we talked about yesterday, that she, maybe the teeth,
Flat bone
third degree
increase,
teeth
yeah.
should be, teeth are too
Flat
flat.
cone, yeah, maybe so.
Is John already gone?
Anybody slide it left?
Yeah, John Merrill,
Okay.
five
You're
fifteen
going to the
bus,
right.
or taxi.
Okay.
Cliff is long gone.
He had the team mom duties for the golf team.
Just a little bit more.
Golf team.
He's a team, his son plays golf.
Oh, so he's,
He's a team mom. Drives into the game, he's a big homer, and wins the ball.
shows up.
Slide it left.
Yeah, oh yeah, plenty of that in the car.
Just wipe all that off, just make sure we don't.
Much better now.
Can you feel it smoother? Yeah. Your muscles are gonna like that. I don't usually do this
What's that, just?
before I have an appliance in.
Yeah.
I don't usually do that.
He's doing what the
Yeah.
patient wants, not what he recommends.
Yeah.
Happens sometimes.
Let me tap you down. Okay. There's the green one there. We're keeping our centric stops in the middle here now.
Is that a two-surface gold foil?
Two surface?
Looks like it's been gold,
We're in the centric stop, these are really fine little, that's real fine little.
So you got your balancing interference there, or what are you working on, centric stop or?
I keep my centric stops and I'm giving them, I can slide, he's, without his back.
You're
Yeah,
working on
balancing
balancing interference.
Yeah, so now it should,
Oh,
it
it's
should,
not bad.
should slide now.
Mm-hmm.
Maybe he doesn't need the appliance. Oh, his max is still,
Now we're gonna check the other side of the plus. If you balance one side, the other side always changes. Just relax. Okay.
Leave that heavy one on the bottom.
He's hitting real heavy here,
Yeah, that's about it.
and real light right here.
That'll take care of it. Remember the big diamond? Really taking care of the damn thing?
Where's the green?
Lab Hampties, is that what you call them?
No, this has to go
The
flat.
bypass we had heavy?
Uh-huh. Like that. Now you can slide to the right. Okay. That's okay. To the right.
Is that mesiolingual or cut on that molar then? It's in the way?
This in here.
Yeah, that incline, yeah,
Little bit. And I'm gonna keep this in here, and I'm just gonna free up the lateral just a little bit here. Okay.
Barely
We're
there.
hitting down over the edge on this one. That's a cross tooth balancing interference. Those are the most disturbing to the muscle.
on the second molar.
Slide out, slide out for that. Just a little bit. When you see that, when it wraps over the molar, when you slide, you got a cross tooth in the sense there. And I took a little bit off of this to get rid of a little bit of the influence on that slide right here. So this cusp here, banging, when he slides this way, he's supposed to disarticulate here, but he can't hit over here. And this thing, we've got, it's real close. The stop isn't in the middle of the tooth, it's out here a little bit to the side, but still he's going over this way.
So what I'm seeing there is more of the centric stop than it is the
Yeah.
balancing interference, is that it?
But you want that center stop on that incline.
Well, that's my question.
But the point was, what he had was, when he slid out there, the centric stops on that incline, but he had to bump over this edge to get past it when he tried to slide to the right.
Mhm.
So I'm not taking out that centric stop,
Even though it's on an incline.
I'm taking the bump out, that's all. Can't, if I take that whole thing out, then that changes his entire bite.
So if you have him just eccentric, it's gonna be right there, it'll be in red, huh?
Yeah, it was right in the middle right there. See, now he can slide over that without banging on it. Like that, slide. Yeah. Still a little bit more just on that edge. But, maybe I get somewhere good. Oh, occlusion straight now. And back here, when he slid on this tooth, this thing fits up underneath the second molar on the top. Okay, so when he slid out through there, he was banging on right across the inside of this.
You took that away.
Yeah, that's all gone now. Slide that one.
I feel a little something again.
When you slide right,
Slide to the left.
You
I feel
slide
it on the
You
right.
still feel that still? The balancing interference over there?
upper lower tooth on one.
The upper.
you're gonna jiggle me for a new bike record after this, because the previous one was good now, right?
It'll be close, we haven't taken much, we've just taken a half a thousandths off of it.
Okay.
I mean, just, the only thing you can see is the color coming off.
Okay.
It's that slight. Slight.
I think it makes a
Slight,
difference. I
the
always
other way,
mark
the other way,
excursion first and
the
then
other way,
the red to save to, that I don't hit.
yeah.
You do it the other way. Does it matter?
Does, tap down and tap it. Okay. See, when he bites down now, you gotta stop here and you stop right on the corner of this molar. Right there, in the corner. But then when he slides up this little incline right here. And the stop is right here.
Is it stop in red or green?
That's in red. This little stop point right here,
You wanna keep that, right?
there it is, right on the marginal ridge right here.
Mm-hmm.
Okay. And now, slide down, slide this way. And when he slides that way,
He's hitting
he's
that.
not, he's not supposed to be hitting on this right side when he slides to the left.
Right.
Okay, open.
Is it the back, is that the back?
Well, no, see what happens, the stop is on a marginal ridge here,
Mhm.
but when he goes to slide, he slides up the incline on the whole lingual cut.
Mhm.
That's a balancing interference.
You can feel it?
Those are the ones that get people's necks and stuff, usually on the second molar, but he doesn't have them. And right now, slide over. And we're just,
So it's hitting, where's it hitting on the lower?
right up across here, this thing here, of course it's that build up. If you look at this cusp is sticking way down. But we're not touching that centric stop. The centric stop is right here.
Mhm.
And we're back here, so when he slides across that thing, and he's supposed to be sliding off to the side. But he's got a problem right now, because he's not got any custard right now, slides to the left. So he's got that all ground out right here. This is all ground out right here. So he doesn't get anything there, I don't think,
Oh, and it's cutting?
right now. Tiny little bit way out, and then we'll see the other side right now, slide over here. Can't open, right now, slide over here. We gotta have the river do that. Right now, slide over here. He's got a lot more here than here, just barely here.
I remember this build-up fell out.
Yeah, okay. Little build up.
So you have a buildup in this cusp over here?
Yeah. Yeah.
Yeah, this one should be put back on, because this one affects C2 a lot down here.
Same with mine. Oh, my apple, I have to.
And slide down, slide that way, oh, the other way. He's to the left. Yeah, he's coming out of that left slide real good now.
Much better.
Yeah, so I wouldn't do, that's a ton of equilibration at one time, far as I'm concerned.
On that upper molar?
Everywhere, just the whole thing is a ton of adjustment.
So he's better off adding to some cuspids?
Yeah, he's gotta add to this cuspid over here and get the same
Exclusion there?
as he's got here, put a little composite on there.
That's something I can do myself, right?
Oh, yeah.
Mhm.
Yeah. Yeah, Dennis had a terrible mouth. I'm not gonna show you mine. But I'm gonna sit in the chair and you guys are gonna arm reflex.
Oh, good.
Thank you very much.
Yeah. That'll help your,
Big help.
that's gonna help your, the whole, it's gonna help the circulation up there quite a bit, I think.
Yeah, no, I can tell you my visions are sort of going through a shift. Yeah.
It's not the old one, but it'll help.
There's some water run.
Oh, yeah.
So you've had, you got an appliance in too, don't you?
Uh-huh.
You had it in since he was here last?
No, he made
Yeah,
it.
I
Did we
made
make
it.
it? Who
Yeah,
made it?
I made it.
Yeah.
You showed me how and I made it.
Yeah.
I checked it for
The
the
only
first
thing we
time.
didn't do was put composite on top of a hard appliance.
That's what I did Joseph's.
Yeah, I mean, composite, rather than super.
Yeah, yeah.
And when I do the, if I do the composite, it's on the Aculiner, if I've got all the models and everything, and you just tap it in, and when the Aculiner's closed, you light cure. If you're gonna do it in the mouth, you got one side still built up, you trim off the super key on one side, you take your model, and you wipe, you freshen it up a little bit, cut a little super key off, then you put a little bit of the bonding agent on there and wipe it all off, so you can hardly see anything. And then you put your composite on top of that, okay? And then you put a whole bunch of bonding agent on that and just kind of smooth it all the way around. So it really bonds along the margins. Then you go to the mouth and you just tap them in, and you hold them closed, and then you light cure it in the mouth. Light cure it in the mouth.
You're doing one at a time?
You do that side, you do one side, if you're gonna do it in the mouth, you leave everything on one side, and you do that side, and then you adjust the bite and get your stops, and then you go to this side and do the same thing. But if you can't have them tap in and then open and set it, because the stuff bounces back.
Wait, I'm sorry, I missed that.
When you put the composite on, when you're doing it in the mouth, or you even when you do it on the Aculiner, you tap it in.
Is this, excuse me, is this for final restoration?
Yes.
No,
Final composite.
Oh, on your
Composite on a hard
split.
appliance, composite on a hard
Okay.
appliance.
Yeah. If you do it in the mouth or on the Aculiner, you get it all set up so it's right, and you tap it in, and then when the Aculiner is closed, you set the material. Or if you're in the mouth, you tap it in, when it's closed, you go in here and set it. You don't let them open the mouth and you set it on top.
Oh, right, you had to do it closed.
It rebounds.
Yeah. Okay,
No
right,
matter what you
right,
do,
right.
it's gonna rebound.
Okay, with mouth or,
Yeah, so you set it
or
in.
appliance,
And so
or
you-
Aculiner down.
You'll do one side, and then you'll balance, get your centric balance, then you do the other side, close, set it, and then do your centric balance.
Okay.
Yeah. That's the only thing we didn't do.
Yeah.
So, in other words, you're saying that it needs to be closed
Yeah.
or down.
You can't let them open up, you know, because it rebounds, and you're just gonna take a lot more time to adjust it.
Right.
Okay, somebody, one at a time, you guys are gonna test me from arm reflex.
Okay, well, first we're gonna just do a muscle test here. You need to have your mouth open. All right. And hold. Okay, bite your teeth together. Hold. Just a tad bit weaker, would you say? Not much?
Tiny bit, a little bit.
Okay. And then,
Let's do it this way. What I wanna know is how you guys are doing the arm reflex.
okay, just, let's have you relax your arms.
Yeah.
Your elbows are relaxed. Or just bring them back. Or your mouth's open.
Yeah, it's open.
Okay.
Okay, and you're going back too far.
Too far? Should be up along the side of the head
You're
more.
pulling me straight, too straight. Okay, do it again.
I'm pulling it too far back behind you.
Yeah, you're pulling them too straight.
Okay, just relax your arms,
There you
like
go.
this, more like this.
More like that. And then test it, more like that. In other words, when you're pulling me out here, now you're changing the step,
The resting line tension.
yeah, I'm not in charge of where my arms are going, you are.
Yeah.
Mm-hmm.
Okay, as soon as you, when you pull them back and you create tension, you're changing the thing. You
And
get
you're-
it back. you get them back to where they're relaxed, and then you test them and see, you know.
Cause then you're,
Yeah.
you go into an automatic protective,
Yeah, okay.
okay, let me, one last time. Just relax your arms,
Yeah, and then you see where they go. Yeah, okay, now I'm in a relaxed position.
okay, let's have you, close and bite down, please. More like that.
That's all you gotta do, because if there's a problem, if one of these arms, usually the right arm, you'll feel it right away. You don't have to pull way back here to feel it. You gotta keep in a relaxed position, and you're feeling that tension. And if you've got me pulled back, you're not feeling the tension, you're changing it.
Okay, may I? Go limp and ragdoll loose.
You want his mouth open or closed?
Mouth open, please. That's loose. Now, teeth together, please.
Open first.
No, right side tightened up, huh? Same thing.
So you just
Is that
bite
about
which
right?
side the
Yeah.
paper's on it, the
Didn't
same
matter,
side?
Didn't matter.
Okay, thank you.
Opposite side, it wasn't a stunning flexion what side, but you got the right side both times.
The
But
right side both times.
Yeah.
Tighten up.
No, wait a minute, it's not here.
Your
It's
thumb
here.
is on that.
Yeah, there you go, that's where you hold it. Yeah, that's right, that's where you go. Yeah, there you go.
Just over the top of this.
you better open it or close it. That's fine, on one side.
A little bit, I can feel it.
Worse.
Yeah, I switched it on you. I didn't tell him I switched it.
Yeah, yeah.
He picked it up.
Oh, so the other arm got more tense, the opposite arm?
The same arm.
Same right arm?
Yeah. Okay, what do we do here?
That's the way you hold it now.
Open please. Your head is turned just a little bit to the right, is that intentional? Okay, now close for me. Feel on the left side, a little heavier.
Yeah, so just a little off. And I know where it's at.
Well, now we got the burr, let's grind on it.
Yeah. Right there. Right there. I can tell you where it
Oh,
is.
it's good. You want me to? We could mark it, we don't have to grind on it, we can mark it though.
It would be so slight, you would just take the color off. That's how slight it would be. It's right there.
I'll be happy to.
Yeah.
After that
Okay.
test.
Yeah, you can.
You're not wearing a appliance, are you? Right?
No, I wear one at night. About half the time.
Softer, harder.
Softer.
Yeah.
I wore appliances for 7 years. Hard appliance for 7 years. And then I finished myself. So I had a Davies cut the crowns down, then then they put them in and I balanced them. Then a year later, I was about a half a millimeter off.
Really?
So I had all the lower crowns redone.
Half a millimeter off. Yeah.
Very low. So I had them all redone in composite. I took the porcelain out, had them all redone in composite. And now I can add or subtract composite when I have a problem.
So that's when you decided, okay, no more
Yeah.
porcelain.
Yeah.
Okay, all right.
So you don't do porcelain crowns anymore?
Oh yeah, I do porcelain crowns, but not if I'm doing reconstruction type thing. I'll do.
You're doing the whole arch.
I mean, if
Posterior or
if
something.
they've never had any problems, that's fine. I'm not talking about the patients that I've treated for myofascial
18 months
pain.
Go back
of,
and get
18 months of higher appliance.
MIP.
Those
If they're in
patients
for-
only have
If
composite.
they're in for myofascial pain problems, I leave them in composites. You know, either I make or the lab makes. If there's just a patient that's never had any problems, I'm pretty sure,
You just build them to the right
yeah.
occlusion and they'll be okay, yeah.
Okay, fine. As I was coming up, right when it first felt heavier, but this one felt more restricted at the end. That's what I was feeling.
You can almost see the left side is heavier,
And fine.
more heavy.
I can feel it.
Yeah, you can see that the left side is
The left
heavier,
side's a little more
tighter.
stiff.
And your
Tighter.
head is turned this way a little
Yeah,
bit.
on my head, I got
How did that feel with you there?
Yeah, good.
Did that make any difference?
Oh, yeah, all right, okay.
Good, thank you.
Thank you for picking up that marginal ridge thing, I really felt that.
Well, your eccentric occlusion of the stops was on the marginal ridge, so as soon as you went into your excursion.
I was right
it
in
went-
on that
it went
marginal
out-
ridge.
Oh, no, you wrote right down the
That'll
middle
be
of the-
$50.
the lingual canal.
This is a chiropractic office. I just did your upper cervical and your, everything's together, so. That's what he charges.
Are my ankles even?
Oh, well, yeah. It looked to me like.
That's good,
Yeah.
So you're within range.
yeah.
Yeah, you're right. They like to look at the bottom of your heels though.
My right leg was a little long after my surgery. So then I injured myself and really cranked on this hip up here. You know, and then I fell on the steps and put it all back in place. And now they're the same length. And they feel better. I smashed them a little, I think, over there when I lifted them.
When was the last fall you took? You took a fall, you said.
Yeah, well, I
Since you moved.
smashed them in November.
November.
End of October. And it was, third week in December, I could still hardly walk.
So you had to take time off work then too?
Don't. Work.
Hey!
What do you mean, took
Work,
time
work, are you kidding? You never quit work.
This is Iron Man.
That's right.
I've missed 2 days work for illness or not in 40 years.
Wow.
Yeah.
And I've taken a few vacations, but I being sick, I went 2 days.
Wow. Good see.
So I'm going to do this.
Don't push me back.
Am I pushing
Yeah,
you?
you're pushing me back. Can't take a bite
No
out of
thumb,
it.
no thumb.
That good?
That's better.
So we mark that in red first.
You're just an old-time dentist that got trained and you just can't get out of it.
Oh.
Uh-huh.
Oh. That's
Yeah,
weird.
just use the index finger under the chin, don't.
Oh, I want to try that.
Just do the index finger under
You
the
were
chin.
missing.
Forget Dawson, huh?
No thumb on the chin crease.
Okay.
I'm saying, right, this.
You want the mirror? You want the
Yeah.
mirror to check?
No, that's okay. If he doesn't get it right, I'll go home and make it right.
Huh?
If he doesn't get it right, I'll go home and make it right.
Can you see?
Yeah, but that's work.
That's pretty
I
good.
mean, that's not even a
You can
I'm
see,
gonna touch one of them.
you can see the buildups I had to put on the composite crown.
Yeah,
Mhm.
yeah, yeah.
It stayed real put for a long time now.
No, it's done.
It's just holding on. You feel like I'm pushing you back? How's it feel on your inclusion?
Still a little high, I'm only hitting on that side, I'm not hitting on the left side.
1 point on that side or the whole side?
At 1 point, see there. Now you're pushing me back now. There you go. That's good.
If you hold your mirror, it looks like it's off of that and now it's low.
Catching?
There, there. I'd leave that one, be the one that's on the lingual cusp, lingual limb cut, or the lingual. Hmm? Can you hear me? Open, please.
Still hitting only on the right side.
Hmm.
Now, when I bite, I can hit on the left side, but when you tap it real
Appropriately?
yeah, it's only on the right side.
Just like Blake's done.
It's not?
This one is a little shorter.
You sure?
A little bit.
Slide your jaw to the right, back to the middle, slide left, back to the middle, open. Open. It looked like it was just saliva rather than a mark. Does it feel like the whole side is touching?
No, one spot. I didn't hear something. Real slight. That's on
Do you find T-scan useful?
What's
T-scan for this kind of work?
Hmm.
No?
I used to use it.
Huh?
You used to use it.
He used to use
Use
it.
it? Not anymore?
Probably in the TMJ practice, right?
I'm not saying any one place.
He was kind of pointing between the first molar and the bicuspid.
Bicuspid, yeah, but if,
But you don't find T-scan in this situation useful?
I tried using it several times. And, I didn't, yeah, for the time it took me to do it all, relaxed subject, knowing how to adjust occlusion, I get the same results, so I quit using it. Might
So-
have to work.
So in this kind of situation, would you find that T-scan is very helpful? Not
It
necessarily?
might be really good for this, yeah.
That's what I mean.
Yeah,
Big
it's gonna point out-
situation.
it's gonna
This
point
is
out-
where I feel.
It's gonna
T-
point out that one little
Right,
spot.
right. This is where I feel T-scan would have
Yeah.
good uses in finishing,
Yeah, finish. Well, that's all it's for,
Yeah.
it's finishing.
final finish.
Final finish, that's all it's for.
Ah, see that lingual, medial lingual, that first molar finally showed up.
Mesial lingual or distal
Distal.
lingual?
Distal lingual, sorry.
Distal
Distal lingual.
Cocoa butter,
Huh?
cocoa butter on the paper.
Oh, is that what it was, huh?
That's
Yeah,
what- that's
cocoa
what- that's
butter
what
on the
I checked.
paper.
You know, more
Cocoa butter
silent.
on ribbon, better write that down.
No, that's not what it will.
Still more right here.
Yeah.
That was definitely big though, yeah. Yeah, now it's being.
Hold up your mirror,
Yeah,
Mike.
yeah, hold your mirror up, you can see it now.
Mhm.
Take that down,
Then
we'll
it
check your
shows here,
ankles.
But it checks
Right
here.
there.
Take that down, we'll check your ankles.
Just a touch.
That mesial angle?
Right place.
Mhm.
Then it's several places too. Bird doesn't take anything away anyway. You got a diamond like they put it up on it.
It's getting better.
Getting better. That's a 12 fluted composite finishing burr. That's what he wants. Composite material.
So do you think it's more difficult to finish down a dentist's case than
Yeah.
a regular case?
You're a human being or a dentist? Yeah, dentist.
No, they make great training cases. You get through a dentist, you can deal with any patient.
Okay. There's
Getting better. You're pushing me back now. One thing you gotta learn how to do is relax this arm when you're testing people. Nice soft tips. They've been doing too much surgery.
Also lay this across both sides, like instead of just
Okay.
missing, relax your jaw.
Let's get that, let's have you,
Nice soft touch.
you
That's
come,
good.
you do it, you do the mark.
Yeah,
Still
it's
shows
still there.
up.
And look at distal buccal groove on second molar, is there anything there?
That's a green one, but not that.
Just about
I'm starting to hear the
Level
contact
now.
on both sides.
Yeah,
Good.
yeah.
Level now.
Is it?
Take a look.
So, within the,
Where's your
Well,
thumb?
Well, my thumb is over,
Over the top.
the chat, this part here is over the most prominent part of the medial malleolus.
Which
you
part
have
of
the
your
difference
thumb?
in the center?
The pad on my.
Oh, right in the middle, so you're right in the
Right
middle.
where the swirl,
You're
like
right,
the
right.
pointy part of your thumb is.
You're right over the
Now-
top of the
right
now
over
I
the
see
most
the
prominent part.
I'm gonna
of it,
just
okay?
touch that one.
Now I'm just gonna go them together and they're right on.
And this is up a little bit, like this.
Yeah.
both sides, nice and even.
Yeah, your ankles are even now.
And it finally, the last place I touched was on the distal of the, bicuspid, where he felt it.
Oh,
Showed up
right.
again.
Originally.
Yeah.
Now, and now when I bite, it was really even.
Uh-huh.
Well, that's
Before I
good.
could always pick up that one little spot.
Mhm.
It's all around the house, really even, I can feel it all the way around.
Okay, so we can test you now.
Yeah, test me again.
Okay. Rack all loose. Smooth as silk.
I can feel it different,
Yeah.
I can tell you.
Yeah.
And I would bite you down too.
No, let me just mess it up a little bit. There's always way. I don't feel much. What do you feel? Left side's heavier?
I feel, now I'll open, now do it again. Oh yeah, I don't know if you can feel it, but it feels like I got, when I'm biting on this thing, it feels like I got gravel in the shoulder.
Oh, yeah, I did feel that, yeah, but,
Yeah.
okay, all right, thank you.
Have you just stay open, please? Just relax your arms there. How's that? Go ahead and bite your teeth. Please. Relax your arms. Okay, there we go. You know what I'd like to do is just tap your jaw, just because I was watching Maggie.
Yeah.
Part of your-
Oh, yeah.
We don't need expansion.
Yeah, you said don't put your thumb up there, just stay underneath.
Yeah.
Perfectly.
Okay.
More like
Oh,
that.
that's good.
Yeah,
Really good.
yeah.
And then kind of come anteriorly a little
Because
bit.
as soon as you start grabbing the chin, you wanna push back.
Right.
So you get in there and
Okay,
you
so
gotta be nice and kinda relaxed and soft.
Class
and
2 back.
Just a lift up, that's,
Better off going to a class 1,
Mhm,
right?
that's good.
Test. How about that?
So I got it in here.
Yeah.
And you don't necessarily, yeah, I've never seen you use two at one time or try to do it that way.
You mean both?
Yeah, not
They
necessarily.
don't make that stuff in horseshoe.
It's just go one side, you the other.
You could do it that way, couldn't you?
Huh?
Better off.
Sometimes my sister will do one side, I'll do the
Oh,
other.
yeah, that's fine.
Because
I've done that sometimes, I hold it.
Because the patient sometimes may favor the side you're checking.
You put it in and they wanna go like this.
Uh-huh.
They get
Yeah.
it in, they wanna go like this.
So you gotta watch for that.
I thought you can't do that. They do it anyway, so, then I have my system
I
put one
imagine,
here and I put
yeah.
one there and
I
then they
imagine,
don't
I
make sure it
imagine that
goes, so
that's,
they stay
that's
straight.
back or
Yeah.
forward. I imagine that it's back, okay.
For checking and balancing interference, it's like, you know, they wanna move the side of the paper, that's just what.
Okay.
Okay, composite crowns. No, I'm done.
Okay.
Okay, let me,
So I should be put in class 1.
Fine.
Chin 1.
your teeth are doing apart,
Yeah, sagittal line.
close together, please. You like that just fine, don't you?
Mhm. Oh, yeah, well,
Good job. See the tooth dentistry stuff.
Chin line.
Thank you.
I need to come.
So how much,
Okay, relax your arms, we'll bring
how
it around the
common
front.
is the surgery every week? Probably every week you're doing,
Yeah.
you know,
Help
2 or 3?
Yeah. Two or three patients,
All right.
probably two or 8 sides, not do 3 sides of the
And
patient.
touch your teeth.
Upper lower one side, extract of the root canal, do 2 cavitations or.
Because do you come and do the upper and lower at the same time?
That's so
Relax
serious.
the front.
You do the whole, everything you do in the upper, because that's one, you can do half the lower.
Not this
You
time?
have to do all the, good things you do all the upper at one time.
That's what he says.
Now I'm gonna tap
But, you know,
your
he's got all those, and then you've got nitrous, and what do you do for sedation? Yeah,
I use nitrous almost always. If they want to pick that up, that's fine. Sometimes Valium
pretty good.
and nitrous.
That's some oral value. That's
Five
about,
milligrams, 10 milligrams. 5 milligrams, 10 milligrams.
yeah, I commonly give it Valium for people who are anxious. So that's about all you do for sedation.
Now, for in Texas, you have to, if you're using Valium and nitrous, you gotta hook them up to your blood pressure and pulse oximetry. Anytime we do surgery, we pulse oximetry, blood pressure, just.
You got those, yeah, you got all that stuff.
When you, it's
Side
just,
thing, right?
okay.
Right.
Okay.
Okay, guys.
Okay.
Well, 6:30.
Yeah.
What else you got on here?
When Don's not here, we can quit.
You go? Yeah?
Yeah.
Okay, okay. Well, good luck.
So what happens?
Yeah.
Okay, thank you very much. Okay?
You're leaving
Yeah,
to the airport, huh?
yeah.
Thank you very much.
Everything.
Yeah? Yeah?
Yeah.
Okay, we'll put it-
Yeah.
Well, my homepage
Really
is,
good.
That's
You heard of Mo's?
Say it again?
barbecue?
Can I ask you a favor, put in this composite
I
back for
haven't
me?
had
On the
it,
custom-
but I
the custom?
think I
Yeah.
heard somebody
Yeah.
mention about it.
Let's go
That'd
next
be a
door.
lot. Yeah. I'd appreciate that very much.
Look in their
It's
iris.
hard for me to go home and do that by myself. Much better to be in your hand.
Their digestive system's pretty clean.
And it's because right around the pupil, it looks.
Looks the same color as outside the autonomic nerve sheath.